Thank you for joining us today. As a reminder, you are all in listen-only mode, but please use the Q&A box to ask any questions throughout this briefing. I am going to turn it over to Dr. Matt Rizzo, ABC's board chair. Dr. Rizzo.
Thanks, Katie. And hi, folks. Welcome to today's Congressional Neuroscience Caucus briefing on a really important topic, preserving mental health during COVID-19. So I'm Matt Rizzo. I'm the chair at the University of Nebraska Medical Center for the Department of Neurological Sciences. I'm also the chair of the American Brain Coalition. And we, together with the American College of Neuropsychopharmacology and the National Alliance on Mental Illness, these colleagues have partnered with the Congressional Neuroscience Caucus to host this briefing today. And that's on COVID-19. And you know, we've all had a lot of problems with social distancing measures to prevent spread. It's kind of turned our lives upside down. I think you know what I'm talking about. Just look around, and you don't have to look far. It's anxiety, grimness, anger, and even worse. And none of us is immune, young, old, and unfortunately, especially the chronically underprivileged, the disadvantaged, the underrepresented, the food insecure. And there's disproportionate suffering for immigrants and people of color. For those with mental illness, this pervasive climate of anxiety, stress, and isolation can be even more harmful. So we're here to talk about this growing threat today to our families and our communities and our nation, and more importantly, to think about solutions. You'll hear some great speakers, Josh Gordon from NIMH, the director, Christine Crawford. We're especially honored to be joined today by Congressman Earl Blumenauer, and he represents the 3rd Congressional District in Oregon. And he, together with Representative Kathy McMorris Rogers, have been working with the Congressional Neuroscience Caucus for a decade, and underscoring the intrinsic role that brain research plays in understanding ourselves and society, communicating progress and benefits of the research, and promoting federal policies to support neuroscience research. Mr. Blumenauer is a lifelong Portlander. He was first elected almost 25 years ago to the House of Representatives. He's done yeoman's work on the Ways and Means Committee promoting healthcare access and environmental reform. He's a champion of patient suffering from neurologic and psychiatric disorders, and importantly for research and researchers developing cures. So many thanks, Congressman Blumenauer, for your true advocacy and friendship on neuroscience research and cures, and especially during this COVID pandemic. So I want to say now that I yield the Zoom to our friend, the Congressman.
Thank you, Matt. Well, thanks for your kind words. Thanks for your leadership. And thanks for being able to have this briefing today. We've worked hard with the Neuroscience Caucus to be able to provide information to members and Hill staff dealing with the many areas of neuroscience. It is collectively probably the largest single area of health, the largest area of disability, the largest area of opportunity to improve the health and well-being of the American public. And what is happening today in the midst of the coronavirus pandemic has literally affected every individual in America, as far as I'm concerned. We see it with our families, we see it with the people we work with, we see it in our communities. Unparalleled stresses in terms of uncertainty that we have seen in terms of the progression and failure to really come to grips with this pandemic. But it's in the midst also of an economic collapse that is unparalleled anytime since the Great Depression. We're watching across the country, and I'll tell you, particularly in my hometown of Portland, Oregon, where there is such concern and frankly outrage about the problems of racial injustice. There is no period in our history, with the possible exception of the Civil War, where we've seen so many forces come together. And we really need to understand the mental health, the psychological, the neurological impacts that are at work here. I am frustrated because I need to go to the floor and preside over the House of Representatives in a couple of minutes. But what you are doing here is vitally important. I hope that this is one of a series of conversations we can have to be able to make sure that we are collectively informed as a Congress, that we are supportive of the areas of investment in neuroscience research and these aspects of healthcare, and the awareness that we all need to be attuned to. I deeply appreciate the work you're doing. I look forward to continuing these conversations and hope that together we can make real progress, because this isn't going away. We're going to be caught in the midst of this challenge for the next, I would say, 2.5 years at a minimum. And how we are coping with these challenges, many of them inflicting unseen trauma on individuals and families, is absolutely essential. And it's going to make a big difference in terms of our being able to make the transition for the health of our families, for the health of our economies, and the strength of our communities. Thank you so much for having this outstanding panel, and for the people who joined in our conference here on Zoom. It's very important, and I look forward to reports from my team about what transpires. Thank you very much.
Thank you so much, Congressman Blumenauer. So now I want to say that I'm thrilled to introduce our moderator for today's briefing, and pleased to meet you. And that's Mr. Daniel Gillison, Jr. He's the Chief Executive Officer of our colleagues at the National Alliance on Mental Illness. He joined NAMI this year and spent time at the American Psychiatric Association Foundation. He obviously has an abiding interest in mental health disorders, and thanks so much for moderating today. Dan, take it away.
Dr. Gordon oversees an extensive research portfolio of basic and clinical research that seeks to transform the understanding and treatment of mental illnesses, paving the way for prevention, recovery, and cure. Dr. Gordon, I'll turn it over to you.
Thank you, Mr. Gillison, for that introduction. It's a pleasure to be here with you. Thank you, Dr. Rizzo, Representative Blumenauer, and Dr. Crawford for joining us later. I'm very much looking forward to the rest of this presentation. I'm going to go ahead and share my screen, but I think I have to wait for Katie to stop sharing hers to do that. There you go. Okay. And presentation mode. There we go. All right. So hopefully everyone can hear me and see the slides, and we'll get right into it. So just briefly, for those of you who don't know, I think, although at this caucus you do, that the National Institute of Mental Health is the principal federal agency responsible for funding mental health research. And our mission is to transform the understanding and treatment of mental illnesses through basic and clinical research, paving the way for prevention, recovery, and cure. And that mission continues through the COVID pandemic, although much of our research activities have slowed down in the interest of safety. They have been resuming over the last month, and many of our activities related to the COVID pandemic have continued throughout. Mental illnesses comprise a very large chunk of the disability nationwide and globally, and that's illustrated here by some old data already showing mental and substance use disorders are amongst the top 10 causes of disability worldwide. They have actually been rising up the ranks over the last few years as we make progress against other illnesses, including infectious disease and cardiovascular disease. But we are talking right now in the midst of obviously a major resurgence of a particular infectious disease, the COVID-19 pandemic, which has affected, as you know, over 4 million Americans directly, with actually now over 150,000 deaths in the United States. This pandemic, as was mentioned by Representative Blumenauer, has really affected all of us in the United States, because even those of us who have not been infected ourselves and don't have loved ones or friends or family who have been infected, we've been affected by the mitigation measures and the economic impacts of this pandemic. One of the things that NIMH has invested in over the years in a considerable way is understanding the mental health impacts of natural disasters and epidemics. And so from that experience, we know some about what to expect in the wake of the COVID-19 pandemic. Of course, COVID-19 is unique. We haven't had a true pandemic like this hit the United States, and certainly not with this scale and severity. But nonetheless, we can surmise what to expect over the coming months. We already see evidence, and I think Dr. Crawford will present some of that evidence to show that much of those exposed to COVID-19, just like previous traumatic experiences, will experience immediate, sometimes intense reactions, and these could include negative emotional states like anxiety, grief, and depression, acute stress states, physical health complaints, poor sleep, difficulty concentrating, really a range of mental health symptoms. The good news from prior studies suggests that for most of those individuals who experience these acute reactions, their symptoms will decline over time without intervention or with minimal intervention. Unfortunately, though, we know from these studies that some fraction of them, in the past it's been about 10 or 15%, will go on to experience chronic mental health impacts. And they would benefit from evidence-based interventions. These less common effects include full-blown depression, development of anxiety disorders that outlast the pandemic itself, what's known as complicated grief, that is a depression-like state that accompanies the loss of a loved one, which interferes with functioning for longer than otherwise might be expected. And of course, post-traumatic stress disorder, the quintessential stress-related mental health problem. So these impacts we can expect on a broad and large scale, and some fraction of them, something around 10% of individuals experiencing these impacts, may have long-lasting mental health consequences that outlast the pandemic. We also know, in addition to the basics about the impacts, we know something about resilience and risk factors. So what do we know about resilience factors? We know that individuals who maintain some sense of control over their pathway through a traumatic experience, as well as hope for the future, will generally rebound in terms of their mental health symptoms more rapidly and more fully. We also know that those who are able to meet their immediate needs to maintain their health and safety, their medical care, their food, their shelter, etc., that will be a resilience factor. And those who practice healthy coping habits, this include eating and sleeping in healthy fashions, tracking, sorry, I don't know exactly what, there you go, tracking, making goals, setting them and reaching them, reaching out for social supports and helping others. These can all help reduce the mental health impacts of traumatic situations. We also know a range of risk factors that predict poorer outcomes, more severe outcomes, and more long-lasting outcomes. And this includes people who experience a sense of uncertainty, and that probably describes many of us. But importantly here, the issue is how much uncertainty you're experiencing and how much can you plan, going back to the resilience factors, for your own pathway through the traumatic experience. Direct exposure to morbidity and mortality, seeing people who are ill, who are injured, who are sick, witnessing death, and or the deaths of someone close to you, that is a risk factor. Pre-existing mental health problems, mental illnesses are a significant risk factor. If you have a previous history of mental illness, that is going to make it more likely that the mental health impacts will be more severe and more long-lasting. And finally, and this is a big one for the current pandemic, social and economic vulnerability. If you can't meet your immediate needs, that places you at further risk for complications. So that means that there are vulnerable populations who tend to have more risk factors and fewer resilience factors. These again include people with pre-existing mental health problems, but it also includes health disparities populations. And one might ask why, and some of the reasons for that is shown on this slide, that individuals, for example, African American young adults with serious mental illness, they meet at least two of these vulnerable populations. They are less likely to get adequate treatment, and they are less likely to receive evidence-based treatment. But it's not just disparities populations and pre-existing mental health problems. In the current pandemic, we can anticipate that the healthcare workforce, because of their exposure to the illness, may be at higher risk. And importantly, again, for the current pandemic, frontline essential workers, and by that, I don't just mean healthcare workers, I mean the people who are delivering our food, the people who are staffing our grocery stores, the people who are out there every day doing their job to enable us all to be sheltered in place and placing themselves at risk. These are the vulnerable populations that we can anticipate will be at greater risk in the current pandemic. What are we doing at NIMH to try to help people build their resilience? I like to say that resilience is not something you're born with. Resilience is something that you can learn. And again, one of the best ways to do that is to practice good coping strategies. We and other organizations, including NAMI, have been putting out a lot of information on effective coping strategies. And these are some of those resources that we've put out on our website and in other locations. There are additional COVID-19 resources really across the federal government, be it the CDC or the NIH, to help people develop healthy coping strategies given the current efforts. So that's what we know, and that's what we're doing to try to promulgate what we know. But we have to acknowledge, as I mentioned at the top of this talk, that we don't know everything that we need to know about pandemics, particularly about the COVID-19 pandemic, in order to build resilience currently, and also in order to strengthen our response to future pandemics. So we at the NIH in general and at the NIMH specifically are engaged in a broad and deep plan to conduct research in the context of the current pandemic. That plan is articulated in a document that was published just about 2 weeks ago, called the NIH-wide Strategic Plan for COVID-19 Research. This provides a framework for accelerating the development of therapeutics, for vaccines, and for diagnostics, but also for understanding the various impacts of the pandemic on health, including mental health. The NIMH's part of that strategic plan includes trying to measure the impact of the pandemic on mental health and also test interventions, which from previous work we have reason to believe will be effective at building resilience and decreasing risk, testing those interventions in real-world settings during this pandemic itself. To do so, we have reprioritized some of our research funds towards COVID-related research. Information for applicants we've been placing on the web. We've also put out notices of interest to recruit applications in this area, and we have actually just in the past week been making funding decisions on those applications, and we expect that research to be started up within the month. It's been a lot of work on behalf by NIMH staffers on behalf of the American public to get this going. One NIH-wide effort that I just wanted to alert you to is called the Social, Behavioral, and Economic Impacts of the Pandemic in Vulnerable Populations. This is really a four-pronged effort to study these vulnerable populations that I discussed: health disparity populations, people with pre-existing conditions, the elderly, frontline workers, and essential workers. And this comprises efforts to study the impact through data science and longitudinal studies, and also to test interventions, particularly interventions that can be easily implemented in the current pandemic context, such as digital interventions. So we have a number of studies that we are really engaged in trying to help figure out the best practices to reduce the mental health impacts of this pandemic. And with that, I'll turn it back over to Dan, who is, I believe, going to introduce the next speaker. Thank you very much for your attention, and I look forward to fielding questions.
Thanks, Dr. Gordon. Before I introduce our next speaker, let me just do a little house cleaning here. We're going to do Q&As at the back end, and I understand a few of you may not have heard me at the very beginning, so my apologies for that. As I do this introduction, I'd also like to say if you have any questions, please add those to the Q&A that you can see at the bottom of the screen there, and we will get to those shortly. So our next speaker is Dr. Christine Crawford, who is the Assistant Director of Psychiatry Medical Student Education and an Assistant Professor of Psychiatry at the Boston University School of Medicine. She completed her adult psychiatry residency as well as child and adolescent psychiatry fellowship training at Massachusetts General Hospital, McLean Hospital. She received her MD from the University of Connecticut and her master's in public health at Boston University School of Public Health, where she concentrated in social and behavioral sciences. During residency, she was the recipient of the MGH Laughlin Award and was selected by the American Psychiatric Association as an APA SAMHSA Minority Fellow, which provided her funding to develop community-based interventions to reduce mental health stigma within the Black community. She has been engaged in a number of community outreach initiatives through the Boys and Girls Club of Boston, NAACP, and NAMI. She has authored multiple book chapters on mental health disparities, socio-cultural issues in psychiatry, as well as peer-reviewed publications focusing on major depressive disorder. With that, I'd like to introduce and hand the floor over to Dr. Crawford.
Thank you so much for that introduction, Dan. I'm just going to share my screen right now. Okay, thank you so much for having me. And again, thank you for that wonderful introduction. And I'm so happy to be able to have this opportunity to talk about such an important topic, and that having to do with the impact of COVID-19 on Black mental health. And I appreciate Dr. Gordon's presentation that gave background information about the impact that COVID has had on everyone's mental health. But for the sake of this presentation, I'm going to talk about the unique factors that makes it such that Black people have been adversely impacted by this pandemic in a multitude of ways. So my introduction was already mentioned, but I just want to highlight the fact that I'm an adult and child psychiatrist, so I wear the hat of being able to have an appreciation for how this pandemic has impacted children and families as well as caregivers. So I hope to infuse some of that background knowledge into this talk today. And I work at Boston Medical Center, as well as a community health center in Boston known as Codman Square Community Health Center. I just want to share a little highlights about Boston Medical Center so you have an understanding as to the type of patient population that I'm working with when I work in the adult child psychiatry outpatient clinic. So Boston Medical Center, also known as BMC, is actually the merger of two hospitals, the city hospital as well as the public private hospital that was associated with Boston University. And the mission behind BMC is that it's a facility that provides exceptional care without exception. And so that shows you how there's this beautiful marriage between the public responsibility of caring for this population, as well as the academic excellence that is inherent from Boston University School of Medicine. And BMC happens to be the largest safety net hospital in the region, and it disproportionately serves folks who are low income. And the overwhelming majority of the patients that we see at Boston Medical Center, more than half are Black or Hispanic, and a third of our patients do not speak English as a primary language. And so we see a number of outpatient visits a year, over 1 million, and the majority of our patients are on public insurance. And it's also the largest provider of trauma and emergency services in New England. So this gives you a sense as to the environment that I'm working in and the type of patients that I've been seeing, and how that has helped inform some of the things that I'll be talking about, because I've actually seen this in a clinical context. So first, I'll just start off with some background information about the mental health of Black people currently in America. So what we do know to be true is that Black Americans are 20% more likely to experience psychological distress when compared to the general population. And even though overall, when it comes to psychiatric prevalence rates, they're similar between whites and Blacks, but what we do know is that utilization rates of mental health services is less in Blacks when compared to whites. And so we could see on this figure over on the right that was produced by SAMHSA, over here on the left, we see white patients who have serious mental illness, who are adults. So serious mental illness are conditions like schizophrenia, psychotic disorders. And we could see that overall, white people, nearly 70% will use any mental health service, but compared to Black people, only 52%. And these are individuals who have known serious mental illness. And so that kind of contributes to the fact that Black people also experience more distress related to their symptoms. And a lot of it has to do with the underutilization of some of these mental health services and undertreatment. The other thing that's important to know about Black mental health is that in recent years, we've seen that there's been an increase in the rates of suicide among Black children under the age of 13. And there was a study that was published in JAMA Pediatrics that examined children over 2001 to 2015 and did see that children under the age of 13, there was this increase in the suicide rates over this period of time. So it's important to know that psychiatric illness has a direct impact on Black mental health. And you can imagine that having this crisis of COVID-19 and the associated stressors can have a significant toll on the emotional well-being of Black people. So what are some of the factors that are at play when it comes to the toll, the impact that COVID has had on Black people? Now, we've heard in the media, we've seen all of the data and the statistics about how Black people have been negatively impacted by COVID in terms of death rates, in terms of the burden of disease. But we do know that there are some factors that have made it such that Black people are in situations in which they are more prone to be exposed to the virus. So 20% of Black workers are in a job in which they're able to work from home. And we see that there's overrepresentation of Black people in jobs that are considered to be essential. So jobs like working in the grocery store, working in the food service industry, working various positions within the hospital or doing home health care. These are jobs that made it such that Black people were out and more likely to be exposed to the illness and were in these high contact jobs. In addition to that, Blacks and Americans are also more likely to live in areas, dense metro areas, and also to reside in multi-generation households in which the transmission of the virus is further accelerated because of confined quarters and living with folks who are in the elderly population and transmitting the illness to them. We know that elderly people have significant disease burden when it comes to being exposed to COVID. So we could see how it increases the transmissibility of this virus within Black households. And you can imagine the significant stress related to the negative financial implications of this virus. A number of people have lost their jobs, unable to go to work. And at baseline, we know that Black Americans are 1.4 to 1.8 times as likely to live in counties that have the highest risk of severe public health and economic disruption from the pandemic. So a number of factors that have made COVID quite difficult for the Black population and have resulted in significant emotional stress and significant worry and anxiety on the part of Black people. And we also know that Black people, unfortunately, have been directly impacted by this illness in terms of the death rates. Here is a figure that came out of Boston Children's Hospital as well as Boston Medical Center that is reflecting data from April 14th of this year. So this is old data, and you can imagine that some of this data has changed as we talked about some of the changes in the hotspots in the countries and in this country and how certain states have noticed a spike in COVID cases. But you could see here, the blue line, the top line represents the percent of the state population that is Black people. And the gray line below is the percent of Black people who have died from COVID deaths, COVID-related deaths. So as you can see here, in a state like Mississippi, even though Black people represent close to 40% of all citizens within Mississippi, they account for about 65%, nearly 70% of COVID-related deaths within that state. And so you could see here, overwhelmingly in most states, Black people are dying from COVID at alarming rates. So you can imagine, as a Black family who's already stressed financially, who's continuing to work that job, that essential job, and kind of worried about whether or not they're going to spread it to their families. There's just so much tension and worry that folks have been experiencing and how they've been impacted, and the fact that Black people know folks who have died from this illness and have multiple family members who have been impacted by this illness kind of creates a whole sense of trauma experience for Black Americans in this country because of this pandemic. The other thing that's important to recognize and to point out is that this is an incredibly challenging time because we are essentially dealing with two different public health crises. We have the crisis of the COVID-19 pandemic, as well as racism. And these are two incredibly stressful events that have turned the worlds of children, families, adults completely upside down and has created a lot of stress, disruption, and upheaval. And you can imagine that for a number of young children who are living in this country today, that it places a lot of worries that they have on their minds about their health, about the health and well-being of their family members and their caregivers. And it's a tremendous burden that young people, as young as this girl in this photo, have had to deal with. And it's really important to know that even though COVID already was bad for Black people, but to have it in this additional backdrop of what's happening in our current social political climate has just made the experience for Black people in America even more challenging to get through this pandemic. The thing about children is that they are very sensitive and very attuned to what's going on in their environment and very attuned to how it is that the adults in their life are dealing with all of these stressful things that are going on with regards to the pandemic and recent discussions about racism and what's been happening in the media today and in society today around race relations. And so they see that impact it has on their family members. And in a way, they can experience what we refer to as vicarious trauma. So experiencing trauma, even though they didn't directly experience the traumatic event of, having, being impacted by COVID themselves or losing their job, but seeing friends, family members, and even strangers who are going through that can have a toll on them, because kids oftentimes are able to imagine themselves in the place of that person who experienced that traumatic event or in the place of that loved one. And so over time, it kind of increases their anxiety. We see a number of various social emotional difficulties because kids are imagining themselves being in that position and being the one to be affected by COVID or what have you. We have kids who have experienced more sadness. We have a heightened sense of danger and vulnerability. And again, if they're hearing messages that there are people who are against Black Lives Matter, all that these children are hearing are the words. They don't know the actual mission statement behind Black Lives Matter. They just hear the words. And if they hear that people are against it, then what they feel is they feel unsafe. They feel that there are people in our country that believe that their lives do not matter. And those are the messages that they're receiving from the TV. So you can imagine that they feel even more vulnerable. And they're already feeling vulnerable because of this virus that's floating around. We also know that when it comes to caregivers of children who've experienced racial discrimination, we've seen that those kids of those caregivers have increased symptoms of depression. And so we can just imagine that not only with racial discrimination or being the target of various racial incidents, but just trauma in general, you could see that when a caregiver experiences a traumatic event, that the kids are directly impacted as well when it comes to their social emotional well-being. The other thing that's important to know, I know that I just spoke about kids, but it's also important to talk about how symptoms of depression and anxiety have changed over this course of time. So this is a nice figure that I was able to get from the Washington Post that pulls from data from the National Health Institute surveys. And what it demonstrated is that since January of 2019, to May, end of May, beginning of June of this year, that there's been almost a threefold increase in symptoms of anxiety and depression when it comes to Black people. And we see a significant increase across the board, but we see disproportionately that Black people are experiencing more symptoms of anxiety and depression than they ever did before. And just looking at this time period, this is during the end of May, beginning of June of this year, and just kind of thinking about everything that was going on around that time. So it just signals to you that the mental health and the emotional well-being of Black people during this period of time has changed, and we could see the data right there. Now, given that this is a very difficult and traumatic time for everyone in America and for Black people in America, that we've seen an increase in some symptoms, trauma-related symptoms, not only due to the trauma of losing a loved one due to COVID-19 or being directly impacted by COVID-19, physically due to contracting the illness, but also kind of the trauma that's related to the current backdrop of racism and recent events that have occurred in our country. And so we've seen an increase in some trauma-related symptoms. What are those symptoms? What do they look like? So symptoms such as intrusive thoughts. What I mean by that is having unwanted recurrent thoughts or images of traumatic event that's occurred. So whether that's suddenly losing a loved one or experiencing a racial incident that kind of had a negative impact on you. Can also result in an altered arousal state. So we notice that people have had sleep difficulties or problems focusing and concentrating. They've noticed some changes in their energy level, feeling a little bit more startled, easily startled, jumpy, or more on edge. And some people can experience emotional numbing. So they could feel numb and not feel anything at all, or they could avoid certain situations because it will remind them of a traumatic event that they experienced. And there are some mood-related symptoms that can come about from this too. So anxieties, depression, anger, and physical symptoms too of all of the stress related to COVID, especially stress related to kind of the race-related events that have been taking place. So we could see folks who have an increase in their blood pressure, increase in their heart rate, and increased release of stress hormones that are typically released in the fight or flight situation, which is supposed to be a short-term thing to kind of get you through a really stressful moment. But we see this kind of chronic ongoing release of these hormones that have been linked to an increase in chronic medical conditions. The other thing too is we've noticed that there is an increased incidence of trauma-related symptoms in the context of being exposed to traumatic or stressful incidents on TV or in the media and online. And so hearing all of this data about COVID-19, hearing about the impact that COVID has had on society, worries about kind of how to stay safe with COVID, and also worries about what's going on with some of the race-related incidents we know have been associated with the increase in PTSD symptoms, depression, anxiety, some physical complaints, and also an increase in some problematic behaviors such as increased alcohol consumption. So what has happened in response to all of this? So what we have noticed in the mental health field is that we are now able to have more patients access mental health services because insurance companies are providing coverage for televisits, virtual visits that can be conducted over Zoom or on the telephone. And these were visits that were previously not covered. And that has allowed people who are experiencing some of the symptoms that I've just described to be able to talk to a psychiatrist or a therapist. And that these were people who, for a number of different reasons, whether that's because of the commute time or various barriers that got in the way of them actually being able to come into the office, we now are able to see people, especially Black and Brown people, who are better utilizing more often the mental health services that they weren't accessing before, based on that figure that I was showing you. And so I hope that from all of this, because we've been able to reach so many people doing these televisits, hopefully as a mental health field, we can continue to do so we can make sure that people who are experiencing mental illness have access to the services that they need in any form that they need it, whether it's in person or remotely. And I appreciate the fact that there's now a heightened awareness about the impact that COVID-19 has had, as well as the impact that race-related trauma has had. And I am encouraged by the fact that we're even having this discussion during this meeting. And so I appreciate that there is a renewed interest in exploring these issues. And I appreciate the advocacy from NAMI, the American Brain Coalition, and I hope that we can continue the conversation and the hard work that we've been doing to address these issues. Thank you.
Thank you, Dr. Crawford. And what I'd like to do now, in the spirit of the time, is go right to the questions. And want to, first of all, on behalf of our audience participants, thank you and Dr. Gordon for your leadership, your work, and your vision, and your commitment to this work. We know it is not easy, and it's very intensive, and we very much appreciate it. So let's go to the first question. And Dr. Gordon, this one may be for you. What do you anticipate? You did a great overview on the anticipation of the ripple effect and the impacts. What do you anticipate the effects will be on our first responders to COVID-19 in terms of our physicians and emergency management personnel that are working in the emergency rooms?
Well, first of all, we've already seen the impacts on first responders here in New York, where I happen to be at the moment. There have been a couple of rather publicized cases of otherwise healthy individuals who are first responders dying by suicide and other adverse impacts. In general, what we can expect because of two things, the proximity to death and morbidity, and the amount of overwork that many first responders have engaged in at the heights of the pandemic, that we can anticipate they will be at high risk for symptoms. Countervailing those risk factors are resilience factors. So again, to the extent that our first responders can feel in control, can have access to PPE, personal protective equipment, can recognize the important role that they play in combating the pandemic, these can be resilience factors. So the sum of these risk and resilience factors are difficult to predict, but I think we're going to see, if we can judge by previous effects, we can see that individuals with individual risk factors are going to be more likely to be affected with mental health symptoms and chronic consequences, and those with unbalanced resilience factors are going to be probably protected, maybe even relative to the general population.
Thank you very much. Dr. Crawford, we know that 3% of the psychiatrists, between 12 to 16% of the psychologists, and 5% of the physicians are individuals, African-American or specialists of color. How important is cultural competency training in terms of what you shared about, I guess, the underlying issue of trust in going to see a medical professional for communities of color?
It certainly is important, because presenting to a mental health specialist about emotional difficulties that you're having really puts that individual in a very vulnerable position. And if they already have worries about being negatively viewed or judged by the clinician, it's going to make it difficult for them to want to go out and see that clinician and to be able to be open and share what it is that they're going through. And so I know that is incredibly important for all clinicians, even if you don't happen to be Black or a person of color. It's important to have awareness of the fact that people of color have been impacted by trauma and racism and what's been going on with COVID in a number of different ways. And so as a clinician, it's important to be open and willing to listen to that patient's experience rather than making assumptions about what it is that that patient is going through. Because just because a patient is Black or Hispanic doesn't mean that all Black people and Hispanic patients have the exact experience or exact response to what's happening in society right now. So it's important for clinicians to come from a place of curiosity and willingness to discuss this and to demonstrate and convey that they feel comfortable talking about it. What I often notice with clinicians who aren't of color, they would often try to avoid conversations having to do with racism or even recognizing and bringing the person's cultural background or ethnicity into the room. But I feel as though there's more harm that could be done by not acknowledging it at all, even if the clinician has worries about saying the wrong things or making a misstep. I think the biggest misstep is not bringing it into the room at all. And so I think it's just important for clinicians to just have this openness and willingness to explore that with their patients.
Thank you. Thank you. Dr. Gordon, can you please speak to the vulnerabilities of people living with serious mental illness, including psychotic disorders during this pandemic, specifically their higher rates of poorly managed comorbid chronic medical conditions? What role can NIMH research play in the public health response to their needs?
That's a great question. Thank you, Dan, for it. And first, there are many ways in which individuals with serious mental illness are at greater risk from the current pandemic. You mentioned, of course, comorbid health conditions, which also increase risk of complications or severe disease. Individuals with SMI, often because of the medications that they're on, end up with higher rates of obesity and diabetes, which are both risk factors for more severe illness. They also are more likely to be homeless and otherwise facing social and economic difficulties and isolation. And those are risk factors for mental health impacts, but also for physical health impacts from the illness. And may also, although I don't think we have the data yet, increase the risk of contracting the virus and also of consequences from that. So there's lots of reasons why they are individuals with SMI are at increased risk. What can be done about it? Some of what can be done about it would be if we had better healthcare for individuals with SMI going into the pandemic, right? If we, for example, NIMH-sponsored research has shown various ways to improve management of diabetes and weight for individuals who have psychosis and are on antipsychotics. And that involves, pretty intensive and multiple avenue support for nutrition support and help with dieting. And it's cost effective and it works, but it's not being done. So some of what we've already shown could be implemented more widely. Another practice that clearly works in terms of reducing the physical health impacts of mental illness and also improving mental illness care is engaging in collaborative care within primary care settings, where you have psychiatrists and other mental health professionals integrated into primary care networks and engaged in evidence-based care for both physical and mental health problems. So those two methods, if implemented, would potentially reduce the impact. What could be done now? We need to be able to expand access to mental health care and to collaborative care through our practitioner networks, through our healthcare systems. Some of that is being done. Most notably, there's been a real expansion in access to care using digital and telehealth. While there are obstacles in some populations, most people have phones and most people actually have access to that kind of care, and it's been a help, at least in preserving the care that people are already getting. But access to care is really one clear way that we can help reduce the mental health impacts of the pandemic and the physical health impacts of the pandemic for those suffering from mental health, from mental illnesses.
Thank you. And this next question, I'd like to ask both of you to weigh in on this. This is a pretty detailed question in terms of access. What type of solutions are being considered that can help reduce the time to get into a physician specialist or counseling? Having a young preteen/teenager who has high anxiety from this experience, we are dealing with being added to wait lists that is typically 3 months for an appointment. That includes an option for telehealth as a new patient. I have been told there's a shortage of specialists available as well. Are there any policy considerations/incentives to help target this problem?
Well, I know when it comes to child psychiatry, we're already a field in which there aren't that many of us. There are about 8,000 in the country already, and the majority of us are in the Northeast. New York and Massachusetts are out in California. So we've been dealing with this for quite some time. But I do know that in Massachusetts, there's been recent changes with Blue Cross and Blue Shield to increase the reimbursement rates for child psychiatrists who traditionally will mainly only accept cash payment and only see patients in private practice, which reduces the amount of child psychiatrists that are available to be seen in the community health centers or in various other clinical settings. And so I hope that with this recent change with Blue Cross and Blue Shield, increasing the reimbursement rates, hopefully that will increase the number of psychiatrists who are accepting insurance and who are willing to see more patients. Hopefully that can increase access. I think the other thing too is that primary care has been really instrumental in getting people to talk more about their mental health issues and to connect them with community health workers or behavioral health clinicians who are able to provide counseling and support to the patient as they're waiting to potentially meet with a psychiatrist. And pediatricians and primary care specialists are also receiving a great amount of training on how to provide more robust psychiatric services. So I hope that continuing to engage in what's called integrated care will hopefully improve access, but also just thinking about insurance reimbursements for psychiatrists so that we can have more specialists in the pool that will be able to see patients who really need to be seen.
Okay.
So, Dr. Crawford, that was an outstanding answer. I would just add one element to this from a policy perspective, is we do need to figure out ways to incentivize training all across the board. Training for new child, or particularly in the child and adolescent space, training for new child and adolescent psychiatrists, psychologists, and social workers, but also, as Dr. Crawford implied, training for healthcare providers, including community health workers, as well as primary care physicians in mental health. I mentioned at the outset that the vast majority of individuals with increasing mental health symptoms in the context of the pandemic will have those symptoms resolved with minimal interventions. And those are the folks who could be helped with just a bit more education on the part of primary care providers and community health workers. But Dr. Crawford is right. We also need to increase the supply and the incentives for people to practice psychiatry, particularly outside of the big cities and particularly in child and adolescent.
Last question. What are the outcome data from Minority Mental Health Month or from Medicaid expansion on the behavioral complications of COVID?
I don't know that we have hard data yet on the behavioral manifestations of COVID, although I've seen some suggestions that those states that have expanded Medicaid are doing a better job. But I'm not very confident in that. However, in terms of the application of evidence-based care across the board,
Yes.
the expansion of Medicaid, states that have expanded Medicaid are doing a much better job at meeting metrics for the percentage of patients who are treated at all, the percentage of patients with mental illnesses who are treated with evidence-based care. So I think that has been one policy provision which has improved mental health care across the board. And when you compare states that have adopted the Medicaid expansion to states that have not.
Thank you. You know, there's a couple more questions, but we run out of time, and we're so grateful to our panelists and for them to share their time. And we're also grateful to the over 100 members of Congress and their staffers and the ABC members and other supporters of neuroscience research on the call today. For members of Congress and your staffers, we've got a couple of requests. We actually have three. First, assure robust and sustainable funding increases for biomedical research, including mental health research everywhere that it occurs, NIH, CDC, Defense, Veterans Affairs, and so on. Second, encourage NIH and CDC to work together to create registries of surviving COVID-19 patients so their future physical and mental health can be tracked and we are better able to assess the long-term implications of this pandemic on individual patients. And finally, for the House staff, if your boss is not a member of the Congressional Neuroscience Caucus, suggest that they join. As Americans learn to live with the new normal of the COVID-19 pandemic, it's imperative we understand the impact of SARS-CoV-2 on the brain and our mental health. And I really do wish to thank again Doctors Gordon and Crawford for giving us their time and their intellect on today. We very much appreciate it. We hope that you all have enjoyed this session. I want to thank the Congressional Neuroscience Caucus for partnering with the American Brain Coalition, the American College of Neuropsychopharmacology, and the National Alliance on Mental Illness in hosting this briefing today. A special thanks to Congressman Blumenauer for joining us as well. Thank you all. Have a great close to your day and a wonderful balance of the week. All the best. Bye now.